Okay, so I told you I was going to come and visit my favorite hand and shoulder doctor, actually my only hand and shoulder doctor, Dr. Ichtertz. And here I am. And Dr. Ichtertz, it's so nice to be here. Thanks for inviting us in.
Well, thanks for lunch.
That lunch was pretty good.
It was.
Tell me about some of the things you're doing here. Now, I talk a lot on the air about the virtually no scarring, no pain, and the therapy is so much shorter, if at all. Tell me a little bit about, let's say, trigger finger.
Well, that's often one of the most painful things that can affect a person's hand. And I've been working, I'm basically trying to minimize pain and speed recovery in any patient I treat. And it stems from a desire to prevent people from having to take time off work and be on disability, etc. It's a challenge. Okay, and I've worked out the best medications, oftentimes are very inexpensive, and the best technique. And from time to time I have to make little changes or improve upon it, okay, as circumstances demand. But for example, trigger finger, rather than having somebody having to go to a hospital or a surgery center and have their hand cut open, I solve it all with a special needle, a special local anesthetic that they don't even feel. Most doctors don't even know it exists. And so it's literally something they come in during their lunch break and go back and no one even know they went to the doctor. But occasionally I like to have my own lunch, so. but you get the idea. Okay. And I don't have to limit them. Depending on the individual, some people may be sore enough for a couple of months that they don't feel completely doing certain tasks, but it's never disabling the way of doing it. Okay. And I offer similar things for tennis elbow, not with these ridiculous expensive things that are sort of improving like 10x. I don't have to take people to hospitals or surgery centers unless, some people are so anxious that you can't do things with them in office. It'd scare everyone out of your waiting room.
Mm-hmm.
So those people, you offer them the right medicine. We meet them at
right, the outpatient. Let me ask you something before we move on from that.
Yeah.
A lot of people might be watching this and listening to it and they think, well, I've got this pain in my finger or in my elbow, but I don't shoot guns, I don't play tennis. How could I possibly have trigger finger or tennis elbow? That just doesn't seem to fit.
Those are sort of the names, the eponyms as we call them, aren't always fitting. Most people who get tennis elbow are not tennis players. They've never even seen a tennis racket.
Right.
But the things are, these processes or diagnoses are interrelated. The same person that gets one of them may get all of them. So there's carpal tunnel, cubital tunnel, which is symptoms from a pinched nerve at the elbow, trigger digit, to quervatus tendinosis, which is sort of like trigger digit, it's much more painful in the thumb side of the wrist, and arthritis at the base of the thumb. So in most of these, unfortunately, or let's put it this way, about 2/3 of the people coming with these are women.
Mm-hmm.
And every study.
Because we do all the work.
I think that's what it is. Okay. In fact, the arthritis at the base of the thumb has been probably 10 or 12 women per man, but there's definitely a preponderance of ladies in that. And I don't know, what did I answer your question?
Yes,
Sorry, yeah.
and so if somebody has some pain in their fingers or pain in their elbow and they're not really sure what they need to do, the first step would be to come to the Nebraska Hand and Shoulder Institute, because you can tell them, yes, that's what this is, even though you don't do any real repetitive movements a lot. Of course, we're all very familiar with the carpal tunnel. That's
Right.
from repetitive actions. But with some of that other pain, they may not know why they can't sleep at night, why they're waking up in the middle of the night because they've turned over on their shoulder or they've leaned on their elbow in the middle of the night and they're just awake from pain. They don't know why.
Well, so that's true. A lot of people actually with these problems don't have pain, or like carpal tunnel. A lot of people it's just numbness, or numbness that awakens them, or they're clumsy and dropping things. It starts with listening to the person, letting them tell their story, and then asking the right questions. By the time that's been accomplished, you pretty much, with almost any disease process, we have a really good idea what's going on. Then there's tests that are sometimes necessary. So a little hands-on, measure grip and pinch strength. A lot of the people have to do a nerve conduction study. It's a straightforward, I think, painless test where you shock the nerves and measure the conduction, look for slowing. Okay. And in cases where the nerve is suspect at the elbow, we usually have to do a separate test. I've got the only testing equipment in the state for that. It's really straightforward, totally painless, called a pressure specified sensor device. And it helps us to accurately figure out what's going on. So it's a combination of these things. And just to give you an idea, there was a person I saw earlier today. He's been saving up 5 years worth of symptoms, just driving him crazy. Pain in the top of his wrist, extremely painful long finger, and weakness. Turns out you get 4 things going on his right side and 2 on the other. If you don't go through it, careful, you're going to miss this. So you have to, look at each thing. Some things require just changing the way position a person sleeps. Others benefit from an injection or pills, and depends on how advanced the problem is. And then obviously certain people need a surgery, and that's where it's very important to minimize discomfort and do the least damaging procedure with the highest success rate. In my hands, carpal tunnel surgery, which endoscopic carpal tunnel has about a 97% excellent outcome. And the cubital tunnel is probably 90%, trigger digits close to 100%, so we'll say 99%. And that's very favorable in contrast to what's reported other places, because they're not doing some of the stuff isn't being handled as carefully.
I think that's something that I've talked about a lot, that you've helped thousands of people all across the region, not just in Omaha and Grand Island and Lincoln. But people get this idea in their head that, oh, I've got carpal tunnel, and I remember old Aunt Sue from 30 years ago, she was in a brace for months and had to take time off from work, and it was expensive. And not only do your techniques, you have perfected some of these techniques, but medicine itself has advanced. And do you find patients that come in and say, I just don't know if I'm going to be able to take a month off of work for this?
All the time. And oftentimes, what's interesting, I've got a strong following among self-employed people, because they're seeking someone who can allow them to continue, because they can't afford, with their entire financial empire, if you will, dependent on them, they can't afford to take any time off work. And so oftentimes one of them will refer their friend who's also a self-employed individual, and they've maybe been to a few other doctors and told they're going to have to be off work for 6 or 12 weeks or more, or they often or the wrong diagnosis entirely. And so we help them solve the problem and stay employed.
This is one of the reasons why I absolutely love the Nebraska Hand and Shoulder Institute, because you can come in and you can get a good diagnosis. You can come in if other doctors have said, well, there's not really a lot we can do for you. Maybe that is because they're not going to get the residual, the therapy coming back and the billing and stuff, because you look at it and say, this is what needs to be done, and it gets done and you're done.
That's true. Using the protocol, it's pretty straightforward what I do for each specific thing, but very few of my patients actually end up requiring formal hand or physical therapy.
But that is available on the
right.
rare occasion that it is needed.
That's right, or particularly if they need special bracing. And I apply this to knee surgery as well. I mean, I'm known for what I do for mostly with the upper extremity, but I also do other general orthopedics stuff. So.
How long have you been doing this?
You're gonna make me tell you that? 32 years.
32 years. You're not just a doctor that just popped up and said, I've got all the answers. You've been doing this, you've been studying this. You and I have had long conversations, and I'm so impressed with all of the background that you do and all of the research that you do. So you are always on top of what is going on, and maybe on top of stuff that isn't really even out there yet, because you've dug deeper into more relief or more procedures that can be done.
That's right, and some of it comes about by serendipity. It's like the medication I told you about that's so special we use. I found that out because an anesthesiologist ordered something he didn't want. And what is this? I investigate, next thing you know, I'm using it because it works so well.
Somebody's listening right now or watching right now that is in pain, and they're thinking, okay, this sounds like maybe what I need to do, so I need to call the Nebraska Hand and Shoulder Institute. You are in Omaha, you're in Grand Island, and in Lincoln. So you have offices across the region.
That's correct.
So if they're not in Omaha, if you're listening someplace else, they can still get you.
That's right.
in the fair country. Yeah, they took our state fair to Grand Island. Did you get to enjoy that this year?
I'm not going to admit that.
Okay, but there are other options, not just the Omaha area,
Right.
because we have listeners all over, and especially with the iHeartRadio app. So they can still get in touch with you and make that appointment. I mean, it's just an appointment to come and talk to you. And
Right.
great bedside manner, can I just say, because I love talking to Dr. Ichtertz. So you won't
Thanks.
he makes you feel very at ease. And he'll answer all your questions. So when you walk out of here, just in the very first appointment, people are walking out of here feeling much better without having anything done yet.
I'd like to point out, and it ties into this concept, that even if a person's not on a plan that we're working with, I still say, we've proved this, if you do the analysis, we save them a load of money because they're not losing time from work. I mean, if you count the amount that you would lose per day of loss of wages, multiply that by the number of days, obviously, and figure that versus what another place is going to charge. Ultimately, I still save the people money out of network.
And I've said that, well, maybe I want to take some time off from work. Maybe I want to have, well, let me just tell you, I spent 3 days in bed recently with my back that went out. And after about 3 days, you don't care. You want to get back to doing anything. So it might sound good. Oh, yeah, take 6 weeks off. 6 weeks off is not fun, and it's not very beneficial financially, as you said.
Thanks.
Well, Dr. Ichtertz, I'm going to make sure that I continue to tell people this is the place to be, helping thousands of people and get them in here so we can get people feeling better.
Thank you. Hey, by the way, so what did we do about the traffic the 3 days you were tied up in bed?
Yeah, well, it was Saturday, Sunday, and Monday, and Monday traffic was not done by me.
Oh, that wouldn't have been the same.
But it was done very well. It was done very well. Terry took great care of that. But I thank you so much for your time today and getting this information out. I talk a lot about it on the air, but this gives us a chance to really get deep into some of the procedures that you have. And so thanks so much for watching, and thanks so much for listening. Thanks for having us in today.
Thank you.